Welcome to Ethnic Media Services weekly national news briefing, which today is co-hosted by the Miami-Dade chapter of the National Alliance on Mental Illness, otherwise known as NAMI. Thank you for joining us. I'm Sandy Close, EMS Director, and today's moderator. We're focusing this conference on the mental health challenges facing children and youth, which have accelerated during the pandemic. Last October, the American Academy of Pediatrics declared mental illness among children and youth to be a national emergency. If you are like me, you may have no idea what to do when you realize a young person, even your own child, a friend, or someone you work with, is confronting a mental health crisis. The healthcare system may be inaccessible, inadequate, unreliable. Who do you call? What do you say? What if you do or say the wrong thing? Today, we will hear from a national data expert about the broader trends in this field, and then we will zoom in on Miami-Dade County to hear from 4 speakers and a 5th, the president of the board of NAMI in Miami-Dade, a psychiatric nurse, a young person who faced her own mental health challenge and now works with NAMI, a parent of 3 sons, teacher, instructor, and coach. And we'll hear from them about the trends they are observing and their recommendations about what can be done. All work with the Miami-Dade chapter of NAMI, which is, as its name suggests, an alliance, a network of people who all share lived experience with mental illness. We will send expanded bios of each speaker along with a video of today's briefing and all collateral material. For example, the slides that one of our speakers will present later this afternoon. We ask speakers to speak slowly for our interpreters, and we urge reporters to enter questions in the chat box, which we will take as time allows. Before our panel begins, we're taking a 60-second break to ask attendees to fill out a Zoom survey with only one question. What topic would you recommend for future briefings? The survey will pop up on your screen now. Please answer with just one word or a short sentence. Jessica, is there something I should explain? Is this going to be in the... Okay, because I'm on multiple channels for our interpreters, we have to ask you to fill out your survey on the chat. Next time we try this, we'll try to make it so you can just fill it out on Zoom, but please go to your chat and fill out the survey question. Thank you. To begin our briefing, we present Susan Ratcher, Board President of NAMI Miami-Dade. Ms. Ratcher, you are giving us our formal welcome. Thank you so much for co-hosting today's briefing.
Thank you, Sandy, and welcome to our colleagues, our reporters. This is a very important opportunity to lift up significant messaging. For those who were not participating in our last briefing, as Sandy mentioned, NAMI Miami is a Miami-Dade and Florida Keys affiliate of the largest mental health organization in the country. We are a peer-based organization, which means that our programs, our education, our outreach, even our staff in the office are facilitated by people who are especially trained according to national models, most of which are evidence-informed or evidence-based, with lived experience with mental health conditions. NAMI Miami's programs are free to the community, and we offer education classes for family members with loved ones with mental health conditions. We offer support groups for individuals with mental health conditions and support groups for their family members. We offer education classes for individuals with mental health challenges. And we have a warm line that will connect people in the community with our resources and with our programs. We also have robust prevention programs, one of which you will hear today by my wonderful colleague, Fanny Placencia, that reaches youth and their families with education and awareness. And we have a very robust suicide prevention program that educates about warning signs, how to talk to a loved one about self-harm and suicide, how to help a friend, and when, where, and how to access resources. You'll hear today about the escalation in youth suicide ideation and mental unwellness and self-harm. And our programs are directed to help these young people and their families navigate mental health issues and conditions to achieve mental wellness. I'll just close by saying that NAMI is my volunteer passion. My day job is with the Wallace Coulter Foundation. Many of you may know of us. We're the largest funder of the Asian American, Pacific Islander, and American Indian and Native Alaskan civic engagement in the US. We were driven to this work with the belief that these vital communities deserved an opportunity to realize the American dream. And to do that, their voices needed to be heard, and they weren't being heard. And so we educated those communities about census, about voter registration, about getting out the vote, and about developing leaders that would run for office. Representation and civic engagement of civil rights. And I have to tell you, I also very strongly believe that access to mental health care and support and understanding is a civil right, just like voting, just like being counted in the census. And unfortunately, care and mental health literacy are elusive to many communities. That's why these two missions seem to, coalesce in a way that I couldn't have known. And just like Coulter does with civic engagement, NAMI does with mental health. We have to start with education, knowing what you need to know, knowing that you have a right to get help, and knowing where to find help. Many of the community organizing skills that I learned working with Coulter were applying to the mental health community and to mental health literacy and care. And I'm grateful to Sandy. We worked so effectively on the census, and we took that relationship into the mental health realm, and to ethnic media and to our panelists for bringing this important information to you. And for the reporters for bringing this information to the communities. And I also want to thank the Florida Department of Children and Families and Thriving Minds South Florida, our managing entity, which is our safety net mental health system of care, for supporting NAMI's work and supporting this initiative. And with that, I'll turn it back to Sandy. And just know that you could go to NAMIMiami.org and get information about mental health conditions, about our programs, and access to community resources.
Thank you, Susan. We will now introduce our first panel speaker, Beth Jaros. That's spelled Jarosz, Program Director in U.S. Programs and Acting Director for Kids Data, the Population Reference Bureau. Ms. Jarosz, please go ahead.
Are you able to see my screen, to see my slides?
Yes.
Whoops. Are you able to see, are you seeing speaking notes or slides?
Both.
Both.
Let me try that again.
I think.
Let me try one more time, and I will share my other screen. There's always something that goes wrong in technology. Thank you all for your patience.
I would say that looks great.
Okay.
Okay.
Let's go for it. All right, you may, even if you're seeing my speaking notes, that's fine. We'll go with it. Hello all, I want to thank you for inviting me today to talk about trends in teen mental health. I'm Beth Jaros, Program Director at PRB, where I work on issues of population health and well-being, and you can find me on Twitter at DataGeekB. One of my projects is Kids Data, where we track child well-being. While Kids Data focuses on California, there is a ton of national data plus research that is relevant regardless of where you are. Before I start, I want to tell you a bit about the information I'll be sharing. I'm a numbers person, so unlike today's other panelists, I'm going to be sharing data on suicide rates, hospitalizations, and overdoses. But each one of those numbers represents a person. I talk about numbers because we need to understand the trends in order to change trends and save lives. As you can see on the screen here, youth ages 15 to 19 are shown in light blue, and ages 10 to 14 are in dark blue, and I will keep those colors consistent throughout. I'll share US trends, and we'll add Florida and Miami data where possible. If we look at the US suicide rate on this chart, we can see that the suicide rate for 15 to 19-year-olds is nearly 60% higher in 2020 than it was in 2007. Perhaps even more troubling, we can see that the suicide rate for 10 to 14-year-olds in 2020 is more than triple the rate in 2007. In Florida, for 10 to 14-year-olds, you can see a lot of gaps in the data. That means data were suppressed by CDC for confidentiality. That usually happens when there are fewer than 20 cases. But even with those gaps, we can still see a rapid rise from 2018 to 2020. The suicide rate for 15 to 19-year-olds more than doubled from 2010 to 2020. To put Florida's rise into context, I compared it with the 3 other largest states in the US. From 2010 to 2020, rates in California rose by about 33%. Rates in New York barely changed. Rates in Texas rose by almost 80%. And rates in Florida rose by more than 100%. In Florida, youth suicide rates are highest for white and for Asian and Pacific Islander youth. Rates for Black and Hispanic or Latino youth are similar, but I want to point out that rates for Black youth are rising fast. They have doubled in the past 2 decades, and most of that increase was just in the past 10 years. You may have noticed that the data for Indigenous populations is suppressed in Florida, but I don't want to ignore those youth. Nationwide, we know that they face suicide rates many times higher than for other groups. Within the state, Miami is doing better than average. Youth suicide rates are lower than the state average and lower than the Tampa and Orlando areas. However, they have risen by nearly 60% in the past 10 years. And of course, the suicide rate is just one indicator of the youth mental health crisis. Self-inflicted injury hospitalizations have been rising nationwide. They more than doubled between 2009 and 2020. Unintentional poisoning deaths, most of which are drug overdoses, had been fairly stable, but they rose sharply during the pandemic. So who is at high risk? From the data, we know that Indigenous youth who experience childhood adversity, like a suicide in the family or abuse, or living with someone with substance abuse problems, are at risk. LGBTQ youth who experience homelessness or who are in out-of-home settings like foster care, are at increased risk, as are youth who experience bullying. We also know that there is incredible unmet need for mental health services. 1 in 6 youth have current diagnoses of ADD, ADHD, anxiety, behavior or conduct problems, or depression, but only half received mental health treatment for those problems in the prior year. Later on in the panel, you'll be hearing specific actions that people can take to help address this crisis. In my slide deck, which will be made available, there are some specific policy recommendations. So what can we do to address teen mental health? We can destigmatize and expand access to mental health care. We can replicate what works. Look at states like New York, where there hasn't been an increase, and figure out what those states are doing. What policies do they have, and replicate those in places where rates are rising faster. Reduce childhood adversity. We know that discrimination and difficult life circumstances increase the risk of mental health challenges later in life, and we can make those changes and break the intergenerational cycle of violence. And center the needs of youth who are at risk. For more information, you can visit kidsdata.org or reach out to me, and I'd be happy to answer questions. Thank you.
Thank you very much. I was so focused on your presentation and the slides, I forgot to look at the questions in the chat. I'm so sorry. But honestly, that was a terrific overview. Really appreciate it. When you talk, Beth, about the national trends, and then you look at states like Florida with its very rapid rise, as somebody who's worked in youth health, do you have any sense of why some states stand out, like Florida?
I think that's a really good question, and there is no one answer. I think that there are some things like social media that we know are associated with poor youth mental health outcomes nationwide, worldwide. There are also, I mentioned, there are certain groups that are at risk, like LGBTQ youth, and states that have pro-LGBTQ youth that have supportive policies have not seen rates rise as fast. States that have policies that are anti-trans or that are seen as more hostile toward sexual and gender minorities, those are the states that rates have been rising faster. Is that completely correlated? There is some research to suggest that those are linked, that states that have supportive policies have better youth mental health outcomes. So that may be one of the explanations.
There's a question from a colleague, Sunita Sarabji. Sunita, do you want to ask your question?
So No, yes. Sorry, I was unable to unmute. But Beth, I wanted to ask you, with the rise of social media, is there a correlation indicating, the data seem to suggest that there is a correlation between the rise of social media and things like TikTok, et cetera, which promote a certain lifestyle or a certain look, et cetera, and suicide rates. Would you suggest that there is such a correlation?
I don't know if I could say that there's a direct causality between social media and suicide rates, but what we are seeing in research coming out is that social media, and particularly for some groups, is leading to poor mental health, and suicide can be one outcome. If mental health, if rates of depression are rising, if rates of anxiety are rising, that can lead to suicide in some cases. There are things that there are interventions, and I suspect some of the other panelists will talk about that. If someone is experiencing depression, there are interventions that can keep that from progressing to suicide, even if the depression is present. So.
We have a question from Susan Ratcher. Susan, would you ask your question?
Yes, thank you. Florida is withdrawn from the Youth Behavioral Risk Survey that the CDC accumulates. We're one of just a handful of states that have decided not to participate. The implications are serious. Are there other resources that advocates like ourselves can tap into to track data if the efforts that we're all making to convince the powers to be to re-engage are not successful?
That is an excellent question. And as a data person, I will say that my heart dropped when I saw that Florida left the survey, because, as I mentioned, you can't know that there's a problem if you're not tracking it. You can't change a bad trend if you don't know it exists. And so losing that resource, to me, feels like a really big loss for Florida. There are other surveys that get at some of those things. Unfortunately, you don't want to wait until we're at the mortality data to deal with the trend. But there will still be suicide mortality data. There will still be injury hospitalization data. There are other sources, but any work that can be done to reestablish that survey in Florida, I think, would be really key.
We have time for just one more question. And Beth, if you would look at the questions, it's crowded now. The chat box is full of ideas for future topics, but there are questions which, if you could look at in case you can answer during the conference, that would be great. But we have a question from Jyoti Minocha. Jyoti, do you want to ask your question?
Hello, yes. I'm sorry.
It's a very good question.
It's not, okay, yeah. Can you hear me?
Yes.
Yes.
Okay, so I just wanted to know what can be done to reduce the negative impact. We all know about the negative impact of social media, and there's all this legislation and, you know, all the stuff with Facebook and all that. But what can mental health organizations do by putting up something to counter it on social media, so that it can be there as a resource? How much of it do they need to put and promote? Because the negative stuff is promoted all the time, very actively. Yeah.
I didn't mean to cut you off. I'm the clock. I'm the clock watcher. But it's a very important question. And if you have a quick idea, Beth, you want to mention or know of, and then we'll ask our speakers to add their thoughts on the chat.
Yeah, I was going to say, I actually think other panelists will probably have some suggestions that address that. And I see Eddie is nodding. So hopefully we can, in the chat or through the rest of the panel.
Okay, there's a very good question from Donatella, but I'm going to ask you to look at it and answer it on the chat. So we'll go now to our next speaker, Eddie Mullen, a psychiatric nurse with the Jackson Health System of Miami. Mr. Mullen, thank you for joining us.
Well, thank you, Suzanne, for the opportunity. And to start, as you mentioned, my name is Eddie Mullen. I am a family-oriented person. I've been married for 10 years. I have the privilege to be the father of two, a daughter and a son. And both my wife and I are professional, healthcare professional. And because we value people, we choose to dedicate our time so we can serve and care for people in need. As you mentioned, Suzanne, Cindy,
It's okay.
I am a psychiatric mental health nurse, board certified, and have been a nurse for 15 years. 10 years out of this time, I've been working with people suffering from mental illness. And what led me into mental health is because personally, I experienced it through my family. And I think for me to be able to know more in order to help and also helping other people, it was necessary that I take that route. And so far, I could say it's been a very interesting journey, and I'm proud to call myself a psych nurse. Now, let's dive a little bit in what we're here to speak about, especially about children. And also, I have to take a minute to thank Beth for presenting this data. And as we all could agree, the numbers are appalling. So what do we do to address those issues? Yes, maybe nobody has a specific answer, but from the little experience that I have, I can share some trend with you, and then we'll take it from there on how we can address this situation. Now, talking to colleagues and also from personal experience, I can say in the last 2 months, we had seen a rise in the admissions in the hospital. And most of the kids, they will be coming with anxiety, also with a disruptive and impulse control behavior. And clearly we can attempt to connect those with some of the events that have happening in the country, like shootings, right? And also, as one of the questions that was asked earlier, social media. Social media has a very powerful, I would say, ability to drive the way people think. And we tend to show people what we do and our successes. But if we're not being successful, what do we do now? We cannot show that part. And now it can lead us back to isolation, right? And same as adults, kids tend to experience those things too. And we could also remember that an adolescent, their brain are still developing. So we cannot expect them to reason or to cope the same way an adult would. Now, as parents or people who are there to help, we have to be strategic and be preemptive on identifying some of the things that's going on we can look at so we can help them. For instance, withdrawal, which means that if you have a kid, they used to be all around in all activities and they started to isolate themselves, we need to pay attention to that and trying to see why, right? And other things we can look, things we may not really think it's important. It's a decline in their personal hygiene. They stay longer in bed, they disengage, or even if they used to love, playing videos, they're not doing that. We have to know why. And in most severe cases, you will see people that are experiencing mumbling or even talking to themselves, which we call auditory hallucination. And those things are very important. When we see them, we need to act on them very quickly. There's something that Beth mentioned earlier, the stigmatization of mental illness. That is important. The same way, if we have a stomachache and we experiencing excruciating pain, we seek to go to the doctor or to the emergency room. When we identify those changes in people with their mental status or mental health, we need to act on them. We don't wait until things goes south, right? So we all have to have the courage to do that. So one thing I also like to add, maybe, yes, I'm a professional, I may have better ideas on how to deal with it, but how do you seek to help your loved one or somebody who may be in your surrounding? It's trying to make yourself available. And I'm going to explain later on how do we do that. But I would like to share a statement with you in a book that I've read. It's actually written by Boyd and Tempe in The Virtues, a very short introduction. Here's the statement, and I quote, "The truly compassionate person not only relieves the suffering of others, but does so in a way she empathizes with the person suffering." There are two words here I would like you to pay attention to: compassionate and empathize. To empathize with somebody, it requires us to make a conscious effort to put ourselves into their shoes and try to feel what they are feeling. If we're able to do that, then we will be able to compassionately care for them. Now, compassionate doesn't mean you will suffer with that person. It means that you will find whatever the best way to help alleviate that person's suffering. So let's...
Eddie, I need
Yes.
to ask you to wrap up so we can take one or two questions.
Very good. Yeah, I'll do that. Thank you. So one way we can do that, it's attentive listening, respect, and take a non-judgmental approach and patience, right? And also I will close with this little phrase. If you see the piece of love that will yield to that compassion and empathy, that will help you to deal or to help people deal with mental illness. Thank you.
The question from a number of people and from myself, when I talked with you several days ago, you said, beware of reacting with punishments, beware with reacting with discipline. Could you say a little, because my son doesn't get up in the morning to go to school and I'm so frustrated. I have to go to work. Why is he staying in bed? I call him a lazy bum. And that is the wrong thing to say if indeed he is in deep depression.
Definitely. And example is that we want our kids to do well, right? And sometimes we tend to be tough on them, but not acknowledging if they have or they're experiencing a crisis. So even the way we communicate with them is important. Like calling them lazy is that you're telling them, okay, go to that direction you're going. You're not worthy, right? Or even like they say something because they're frustrated, they didn't know how to say it, and it comes out in a rude manner. Instead of saying that you were rude, you could say what you said sounded rude, for them to find that respect you have for them. And when people know you respect them, they're starting to trust you, and they will be open to share their suffering with you.
Thank you. We have some great questions which we'll take up. Henrietta, thank you so much for your questions, which I see Beth is answering in part. But I want to get to our next speaker, and then we'll have time at the end for more questions. Our next speaker is Estefania Plasencia, a youth program coordinator with NAMI Miami-Dade, who will share her personal experience. Estefania, welcome.
Hi, thank you, Sandy Closen. Good afternoon and good morning, everyone. My name is, like Sandy said, my name is Estefania, and I'm the youth program coordinator here with NAMI Miami-Dade. I would like to start by sharing a little bit of my experience living with a mental health condition. I was diagnosed with chronic depression and anxiety approximately 6 years ago, but I started showing signs of mental health conditions ever since I was in elementary school. I was a very apprehensive kid. I felt that everything that I did needed to be perfect. Otherwise, I would get really bad anxiety attacks that manifested in palpitations, sweating, stomach aches, nausea, and even really bad meltdowns. So at the same time, I had issues concentrating. So I became to struggle academically. So it became, I was always struggling with my schoolwork. And so at one point I felt that I was not as capable as the rest of my peers. And of course that really affected my self-esteem. So I grew up, I entered middle school, high school, and the symptoms were still there. They were expressing themselves in a little different ways, but they were still there. It was until I graduated from college that these symptoms paused my life completely. They got in the way of my daily activities. So it was practically impossible to get out of bed. I would experience anxiety attacks, but more frequently. I started to isolate to the point that I really did not leave my house for more than 6 months. Just the thought of it will make me really nervous and anxious. I started to stop texting my friends back, and there seemed to be no purpose at that moment in my life. So it was until a very close person to me convinced me to seek professional help. And so I did. So at last, after 18 years of struggling with the symptoms, I was on my way to recovery. And so I went to a psychiatrist and a therapist. I was put on medication and I'm still on it. It works really good for me. And in therapy, I started learning healthy coping strategies that helped me replace the negative ones that I had replaced over the years. Now, NAMI played a really important and fundamental part in my recovery. I mean, first of all, they helped me realize I was not alone. It became part of my network slash support network slash family. It provided me with very useful information about the resources in the community that I really needed to know. And so through their courses and support groups that I attended, I felt that I was offered validation and understanding, and that really allowed me to work with other people who were also in similar situations, and they were also in their recovery journeys. It has also allowed to share my story with middle school students and also high school students, and that's one of my favorite parts of my job. And now that I've noticed a difference between pre-pandemic and post-pandemic. I really see a marked difference when we go and present. So first of all, we receive a lot more questions. So kids are more curious, and these questions are frequently about how can I ask for help, especially if my parents won't believe me. Questions about depression, anxiety, questions about how to help a friend and what to do if this friend does not want to get help. So like that, we just get a lot of questions. And I just want to say that observing it myself, I do know that our youth definitely needs help. Thank you. I think you're on mute, Sandy.
Absolutely right. Thank you. Question: what could your parents, and this is not to be critical of your parents, but really to tell us parents, what might parents have done differently that would have helped you at a younger age?
Yes, education. Really, they really didn't know anything about mental health. For them, it was this kid that wanted to get always good grades, and he was perfectionist, and he was just anxious. I would even sometimes get scolded, stop being so anxious, stop, you're gonna get sick. And really, education, that would have made a huge difference.
How did they respond? And this is coming also from a number of questions in the chat. How did they respond as your struggles got deeper as you were in college, as you became a young adult?
Yeah, so in different ways. By my father, I was judged. Like, why don't you want to go out? You're being lazy. What are you gonna do? Are you gonna get a job? Right? And my mom started to get worried, of course, and she's the one who started to do more research into this. And once I was diagnosed, my mom has always been so supportive. And my dad still struggles a little bit with the idea that I need medication. However, I mean, after 5 years of being with NAMI and talking about them and bringing awareness, he's understanding better and accepting better the idea of her daughter having a mental health condition.
So what do you think is the most effective way of addressing the stigma, the negative stigma? You talk about education, but practically speaking, is it how, when you talk with the students, for example, you must find people are, or do you find that people are embarrassed at first, but you're suggesting they're a little more forthcoming, more curious? How do you tell them when parents don't believe them? What's your advice?
Yeah, well, first of all, with the stigma, sharing my story, I think that has been the strongest tool to fight against the stigma. Talk about it and share my story. Of course, I was nervous at the beginning. It took a while for me to get comfortable and saying it to other people. And that really is what inspired young people to stand up and share their story. That's exactly because they look at us and they're like, oh, she looks just like me, like you, right? So that this must be normal. And we've had students to stand up and share their stories in auditorium with 200 people. So definitely sharing our story is very powerful.
Thank you very much. I think you'll see more questions and a real appreciation for sharing the story. Is it your sense, Estefania, that there are more people willing to acknowledge that they are having difficulties, or that the times we're living in, the environment a lot of young people are dealing with is causing an increase in the kind of anxiety you experienced as a child?
I think there's definitely been an increase. However, there's more information. After the pandemic, people have talked about that. So they're getting help, yes, and they've been acknowledging that a lot more. However, I'm always with NAMI, right? And I always go and talk about mental health with kids. Sometimes I forget that outside this world, there's a lot of work to be done. Still, a lot of people want really, I mean, when I mention, oh, I have to take my medication, wow, they get like quiet, like, oh my God, let's not say anything about that, right? So yes, a lot of people are asking for help, but at the same time, there's still a lot of people that we still need to reach. But things are getting better. I think so.
Well, that's a wonderful spirit of optimism. We'll now go to our last speaker. And before Mr. Ho, I ask you to start, I want to go back to Beth Jarish, who made the point that Asian Americans have very high incidence of youth mental illness. Beth, could you just remind us again of the data for AAPI youth?
Sure, but let me get the slide in front of me so I don't misspeak. Give me 1 second. Nationwide, the suicide rate is 5.4 deaths per 100,000 youth ages 10 to 19. And in Florida, it's 5.8. The only, for white and indigenous youth, the rates are higher, but Asian Pacific Islander is quite high.
Thank you. We're very pleased to have Joshua Ho join us. And Mr. Ho is providing the perspective of a parent. We've heard from Estefania the perspective of a young person, and we're very grateful, Mr. Ho, for you to share your experience as a parent, also as an educator, a coach, the Dean of Discipline, and also you are the program director for Miami-Dade County Asian American Advisory Board. Welcome.
Good afternoon, everybody. I hope everyone can hear me. First of all, Ms. Close, thank you once again for the invitation for me to speak today. Estefania, thank you for sharing your story.
Yeah, Mr. Ho, why don't you take the video off and just do audio? Or
Okay. Can you hear me better? Is this better?
yes, try it.
Let me try without the, is this better right now?
Yes,
Yes. Can you hear me better?
please go ahead.
Okay, I do apologize. I just want to say thank you once again for inviting me on this platform. I'm going to come to you as a parent with I thought was a loving family, is a loving family. Let me give you a little background of myself. Educated for 14 years, Eddie can attest with me. As a
Does he have two devices
Yes.
logged in?
Do you have two devices logged in, Mr. Ho?
No, I only have one. Can you hear feedback with it?
Yeah, we're hearing like an echo.
We're getting an echo.
Let me try.
Check the,
Is he on the Facebook Live at all?
are you on?
Let me try this again. Is this better? Can you hear me better?
We're not sure.
No.
No,
I'm getting a feedback still.
Do you have your phone?
But it's not going to nobody else.
do you have your phone logged in?
Or are
There,
you on Facebook? Anything where it's like a second.
Should I try logging with my sound system like that?
Yeah, he should just.
it's funny because right before the call, you were coming in very clearly. I'm not sure,
um,
turning off the
ask him
video.
to send- ask him to enter the phone number and a direct message to me.
I'm so sorry because it's such an important story to share. We could try calling you on your phone.
Yes, I'm calling you right now.
Maybe mute your speaker.
Okay. Okay.
No, that,
Now he's mute.
no, that, look,
I'm not calling.
let's try one more.
What phone number is he gonna?
I'm,
It was working earlier.
let's, Mr. Ho, we're gonna call you and see if we can get you on the phone. Okay?
Okay.
We're gonna call you on your phone. So we're dialing in now.
Get your phone.
Can you answer the phone?
Give me your phone so I can call him. You basically have to have one speaker on yours.
Hello, can you hear me?
Yes,
So thank you once again.
just. No,
Probably should log out.
He needs to mute.
Jessica, would you give your advice?
I don't even know what to do. He needs to just
Okay,
log out, I think, like she said.
I think, Joshua, can you try one more time to see if you can recapture the voice we had when we first started?
Maybe take out his headphones, turn his video off.
Turn your video off and just speak audio.
Can
And
you hear me now?
yes,
Is it better?
yes, it's much better. I'm afraid we need to ask you to just limit your story to 5 minutes because we're running so late.
I do apologize. So I'm coming to you as a parent, but taught in the middle school in North Miami for 14 years as a dean of discipline. Knowing that I understood what mental health is about. Because I had students from inner city that went through so much, not knowing that I was leaving my son behind. The students from the from Haiti. It was mostly back in the days when we had 11 families in my school. So my son started having his first symptoms in middle school. He started out with the stomach aches. So I took him to GI, headaches, so I took him to doctors. Staying in, so I had to find out what's happening. And as Eddie said, I said, hey, why are you sleeping so much? Where's your energy? I know that he was introvert, but he was a good kid, gifted student, almost a straight student. A family, pastor's son, loving family, with a safe environment. So we didn't know this is going to happen. So my first reaction was I was so mad, angry. I mean, what is this? You know, I didn't. So I get as a parent, sometimes it's a blame. Like, is it something that I did wrong? You know, is it what's the fault? Am I to blame? And there was a pride as well. You know, as a parent, you don't want to be educated by someone else saying you didn't want to go wrong, because you take your best example for your parents. I have your parents. So at first signs of being angry and frustration, I stopped. I said, let me go to his church leader, and went to his church youth pastor and talked to him. But that didn't go so well. And then I went to a friend of mine who is Eastern medicine doctor. So we tried acupuncture and early medicine as well. It didn't go so well. So we finally went through my insurance and found a counselor who spoke to him, and somehow she was able to open up. But the funny thing was, my son was Googling his own ways, trying to find out why this happened to him. And that's so painful. You're so Googling stuff. And he's telling you that I think I have this. I said, no, I don't think you don't have that. And he's telling me all this stuff. So he did psychiatrist as well. Took some medication, now he's off now. But at the same time, I started now having a conversation. Not just a conversation of saying, hey, how are you doing? I can need to have a conversation that has, how's your mental health? I have 2 boys and 1 daughter. He's 20 now. I have a 13-year-old and a 4-year-old daughter. So yesterday, I took aside my son a little bit, my middle son, said, Jeremiah, how are you doing? How is your mental health? Just let me know what's happening. I'm here for you. And I'm a very aggressive Asian dad. Always high expectation, a lot of pressure. What's the point? You always want to be a part of that statistic. And all statistics has a name. And as Beth said, every one of those numbers is a name. I don't want my son or any of the people that I know to be the name of a statistic. I want to have a statistics of those are well. Let's all trend of people getting well. Sorry.
Mr. Ho, I'm going to ask Susan Ratcher. There's a wonderful video of you telling your story. If we could have permission to share that with people on the call, it may take us a while to excerpt it and send it, but it really, your story is so powerful, and you are also available. We have Korean media on the call, and you are fluent in Korean, Mr. Ho, is that correct?
Mostly, yes.
No, I don't want to flood you with demands, and we'll be careful, but if there are Korean media that would like to connect with you over the coming week after you've recovered from COVID, it's a unique perspective and a very important voice. So with that, I want to ask each of our speakers one final question. All of you have lived directly the experience with either suffering from mental illness and or dealing with loved ones, friends with mental illness. When you tell us that listening, as Mr. Moline said, listening, as Mr. Ho said, as Estefania said, there has to be a compassionate and empathetic, but above all, non-judgmental, some adult willing to listen, willing to respond. I think all of us have had this personal experience, either with our own children or with young people we work with. Your last question that I ask you to share is there one thing you can tell a young person who may think it'll never end, that there is a path forward? Are we being naive to say this can be treated, you will feel better at some point? I ask myself, we want to give hope. What is the best way to give a young person suffering from this a message of hope? And Susan, I'll ask you first.
One of the most powerful things is the knowledge that, number one, mental health conditions are more common than other conditions. Number two, that people recover, as Fanny has so articulated and well, as Josh discussed his son. I'm a family member of a son who had serious mental illness in college. That's the age. Those teen years into the 20s are when mental illnesses present onset, to be aware, but to also understand that you can recover from mental illness. And I would say another resource that I would be happy to send is, you can hear my son's story of diagnosis with schizophrenia, severe paranoid delusions, 4 weeks of hospitalization, and fully recovered to his old self, pursuing a degree in social work, with a straight A, I might say. I'm still a mom and I can brag. But having recovered from very serious mental illness, people need to understand that and there's a reason why we call our program Ending the Silence. That there's so much silence around mental illness that everybody thinks they're the only one living with it. So the idea that recovery is attainable, that it has to be, people need to be treated and intervention needs to happen early, just like any other illness. I think those are important things, and that there are resources for individuals and their families to help guide them through the recovery process.
Thank you. Let me go to Eddie Moline very quickly. Mr. Moline, recovery is attainable. Is that an important message? And how do you best tell someone you will get through this?
Yes, yes, recovery is attainable, but when you have a support system that is there for you and that will go along the path with you, that will understand that, you know, it's not a straight road, but there's bump, and we will jump the hurdle together so we can get there, it's good. And also being able to really develop that trust to know that those people that are there to help you, they really want to make an effort to help you and they're not going to let you down. Now, if you allow me, I'm going to say that quickly. Yes, sometimes we will say it's important to be on medication, to do this, to do that, but sometimes it may be tiring. And we have to understand that and also support the person so they can come back and continue with that course of treatment we want for them. And share love. Love is the key.
Love is the key. Let's go to Estefania. A last message on how you give hope to young people. What made you feel you could get through the dark to light?
yeah, this is not how it's supposed to be. It's treatable, there's help, and definitely you don't have to go through it alone. It'll get it, just as simple as that.
Very, very important words. Mr. Ho, your message to your son that he will get through it, that things will get better. Share that message of hope.
Yeah, my son is not alone. Everyone is not alone. Loneliness is the one that's a key that destroys all of us and makes us think dark things, the negative things in our minds. So we just show everybody you're not alone. You're never alone, guys. Never alone. And that's it. We're not alone.
Thank you. And the last question for Beth. Are there data on recovery?
It's that's a good question. Most surveys track people at a point, sort of take a snapshot of where the country is right now. And very few track people over time. There are some studies that do that, but that's a harder question to answer. What we can say is a lot of people struggle with depression, anxiety, other mental health challenges, and there are ways for them to recover. So it's not data, but I want to really emphasize what everyone before said, Susan and Eddie, that having someone you can trust, who you feel like you can open up to, is oftentimes key. I have some family lived experience in I think all of us, honestly, all of us probably do have family experience with this. And for that person, having someone they felt like they could reach out to and talk to, because oftentimes people who are suicidal are quiet and have a plan, and they might not feel open to talking about it. So if we individually break the silence and talk about our experiences, it makes it safer for that person to do the same. So that's not data-based, other than the evidence I have from my small sample in my own family and friends. But I think that's what the data suggests, is what everyone else has already said.
Well, thank you. And I know we're over time, so I want to really thank Mr. Ho for being in the midst of COVID and having tech difficulties. We will make sure our media on this call hear your story. It's very powerful. Thank you to all our speakers for opening up this very personal, intimate exploration of what is a national emergency, the rising incidence of mental illness among our kids. Thank you, everybody, and sending our best wishes to all for the weekend. Thank you.